The content of this podcast is for informational and entertainment purposes only. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the guidance of your healthcare provider with any questions you may have regarding your mental or physical health. The views expressed are those of the host and guests and do not replace personalized care from a licensed professional.
Welcome to Mindful Moments with Pedro Morante, a space where a nurse practitioner and educator shares real talk on mental wellness, mindfulness, and navigating life in and out of healthcare. Let's take a moment to breathe, reflect, and grow together.
Very important, guys, to start slow, go steady. No, it's not a fast race. We're all in this together.
There's a lot of anxiety, depression, and PTSD going on. So just need to make sure that our message as a provider is heard by our minority patients. Making sure that we are here for you.
Welcome to Mindful Moments. We just hit 100,000 followers for this podcast. I'm very, very proud of all of my guests. Thank you so much. And also today is a very special day because we are joined by another legend. I should say somebody is highly esteemed. She does a lot of things also out of nursing and has a big, strong voice on NP leadership. So our episode title today is Emotional Intelligence in Practice, Elevating Clinical Competence and Leadership in Nursing. So I would like to introduce Dr. Tracy Hicks in the house, guys. Yay!
Yay!
Dr. Tracy Hicks, thank you for being with us and thank you for allowing yourself to be part of this mental health platform that we created. And for those meeting you for the first time, how do you usually introduce yourself beyond your multiple titles?
Oh, wow, Dr. Morante, I love this question. So thinking about my introduction beyond titles. So who am I, right? So we have to really know who we are, right? So I am a human. I'm a mother. I'm a wife, a friend, a mentor, a business owner, and educator. But most importantly, I'm a faith-filled person who believes deeply in purpose, gratitude, transparency, compassion, respect, and equity. I am someone who's experienced significant loss and gain, but I'm someone who realizes there are blessings and humility in all of it. I make mistakes, I strive to learn from them, and I'm one who sees failures as opportunities to do better. At my core, I remain curious, and I am someone who deeply cares about human beings and creating systems where people feel empowered and can truly be well.
I love how you define and also introduce yourself about being human. I think that's part of us and a core of us as being nurse practitioners and also advanced practice nurses, that we are human being, right? That's basically the core of it. And also I love how you stated about compassion, about humility, and also being grounded. And that's very important for all the emerging leaders out there. Those are things that we kind of imbibe with our profession. And now
Of course.
thank you so much for that. And now you emphasize about emotional intelligence in your work in both clinical and academic settings. I know you're very busy, both clinical and education side. How do you define emotional intelligence in a way that nurses and healthcare teams can easily connect with?
Another fabulous question. So defining emotional intelligence in academic, clinical, and I always include professional spaces as well. And we cannot exclude personal spaces, right? Because we have to get that personal space together before we can navigate effectively in all of these spaces, right? Academic, clinical, professional, right? Personal has to be intact. I define emotional intelligence as the ability to understand your emotions and manage them in healthy ways, as well as managing emotions of others. That sounds pretty difficult, but that's part of that self awareness and being in tune with who you are and using that awareness to navigate relationships with clarity. And again, that compassion, accountability, and the ability to have crucial and difficult conversations. I know this is a long definition, but it is thick, it's robust with energy. And I think the key components, not think, the key components of emotional intelligence are that self-awareness, self-regulation, motivation. And what is motivation? That being able to continue on in the midst of adversity and walking in your purpose. It also includes empathy and social awareness. And for me, I consider myself an empath. So that's my favorite component of EI. You know, that is the empathy piece. And just to further expound on my favorite parts, which all are important, but there are three aspects of empathy. And I think in our academic, clinical, and professional spaces, we need to hone into those and lean more into those three triad, the triad, according to the Harvard Business Press. The first one, cognitive empathy. That's the ability to understand another's perspective, not necessarily agreeing, but understanding. And then there's the emotional piece, the emotional empathy, the ability to feel what someone else feels. And then the empathetic concern piece, right? Concern empathy, the ability to understand what someone needs from you. And these attributes are essential in all of those spaces, academic, clinical, professional, and first starting on building your personal space.
I love how you emphasize empathy because we really need it right now, right?
Mhm.
A lot of people
Oh
are
my gosh.
struggling. Yeah, and also healthcare
For healthcare
providers, I
providers.
guess, could also experience burnout syndrome. So
Mhm.
if we put ourselves on others' shoes, right, we're able to at least understand their feelings and be kind and always choose kindness over everything, right, that we do.
Yes, yes, remaining curious, asking questions, understanding.
Yes, and that's the core of our profession to be able to not only deliver care, work with our patients, and also understand where they're coming from, because
Mhm,
everybody's stories may be different, right? My story may be different. How they cope with their mental health and how they cope
mhm.
with their daily stressors may be different.
Absolutely. I
If
love how you mentioned our mental because we all have mental capacities that can wax and wane, right?
yeah,
We say, oh, this person has a mental illness, but we all are on the cusp of that imbalance, right? Because we have good days and bad days. It's just sometimes it affects our quality of life more than others. And that's when we seek treatment, psychotherapy, and things like that. But we don't need to set ourselves aside and say, okay, that person has a mental illness, because again, we can be imbalanced on any given day.
correct. And always, it's a cliche that we always tell this to our patient, it's okay not to be okay. So
Oh
there are
my
some
gosh.
days, right? There's
Hmm.
some days that we are really productive, and some days we're just, oh my god, we are not able to do our job, and also have some conflicts internally, and also our mental health could be not stable at times because of different stressors and different noises that is going on, and also the negative voices, the sabotage that we're doing to ourselves, and
Oh my
that's something that we
goodness.
need to cope with it.
Oh yes, absolutely. Absolutely.
Now, my follow up questions to you, Dr. Tracy, is what are some small everyday behaviors that show strong emotional intelligence, especially in a very high stress environment like healthcare?
Oh, wow. So everyday small behaviors are emotionally intelligent behaviors that you can do. Pause before reacting. Okay. Ask clarifying questions. Like I said earlier, remain curious. Check on your colleagues and regulate your tone even under pressure. That may not be easy, but once you lean more into this concept of emotional intelligence, it becomes easier, something you can work on. And we talk about a gap. So where is that, right? The cause of this is people's inability to remain curious, the inability to be self-centered and person-centered. Those two work in concert. You have to be self-centered to care for yourself before you can care for others. And then inadequate self-care, right? That leads to burnout, as we talked about, lack of confidence, and even imposter syndrome. All of these things are relative to those gaps that occur when we're doing those everyday practices.
I agree with you, and those are stressors and triggers that could definitely affect how we perform and also care for our patients. And if we did not recognize it internally, then we're actually either suppressing it, and what's gonna happen when there's emotional suppressions, it kind of like hinders our productivity, our creativity, and our mental capacity to think correctly and critically.
Absolutely. Absolutely. Mm, this
Here's
is
the
good stuff, Dr. Morente.
Yeah, I love it. And where do you see healthcare professionals struggle the most with emotional intelligence? And what
So,
usually causes
okay.
that gap?
I'm very fortunate. I get to talk to nurses and nurse practitioners across the country, even professions in other disciplines. And the one thing I see in clinicians is self-awareness. That's the biggest challenge, I believe, especially when you're working in survival mode. I would also add empathy, right? That ability to understand others' perspectives, because many times in dialogue, we fail to seek to understand
Mhm.
before responding. And there's a tendency to be reactive versus proactive, if that makes sense, right? And we also have to be intentional about our responsibility. So that is one word, responsibility, but I broke it up into two. Because what is your responsibility or your ability to respond? Knowing the differences is very important, right? So I have ability to respond. So how I respond is so important. I think that's where a lot of the deficit is.
It's very important, like the capability to respond to a stressful situations, right? You can look at
Mm-hmm.
it like a positive or negative.
Yes.
Stressors could be positive, and stressors could also be distractive. Wherein
Oh,
you had
yes.
a bad day and now it's ruining all of your workflow. But when you look at stress and they're in a positive way, you're able to decide and focus on the task and you're able to finish, right? Your workflow
Yes.
in a very productive way. And I love how you
Exactly.
said we take a pause before responding, because sometimes in our life too, right, we kind of like react negatively. Like there are things that we say and we don't mean it, but once we say those words, it hurts the other people or the other party. So I love how you always tell us to be mindful about responding and making sure that you think twice before doing it. Am I correct?
Absolutely.
Thank you. I'm learning so much so we can apply with our practice here. And basically, you have written an article emphasizing the importance of understanding self stigma in SMI or serious mental illness from a primary care perspective. What should clinicians be aware of? And how does self stigma show up in patients even when they appear compliant or high functioning?
Oh, this is another, you're going to hear me say this repeatedly. This is another good question, something that we need to address. And yes, the article focused on primary care, but I think that's pervasive throughout all the issues that we face in healthcare. So when we talk about self-care, self-stigma, I think it hides behind adherence or functioning, right? It's hidden there, right? So what I mean by that is it shows up by downplaying symptoms or apologizing for having an illness or underestimating your abilities. And I think this comes from societal stigma, right? Because it is a learned behavior based on what or who society says you are. For instance, if you treat someone like they cannot do something or make them feel less than, the chances are that they won't do or they may feel less than. And so this emotional intelligence piece is it's crucial in these circumstances because again, we have to realize self-awareness. That includes what are our biases? How do we see people? How do we show up? And how do we respond to them?
That's important. And basically being able to destigmatize mental health and be able to understand, and the way we communicate with them matters most, because a lot of patients, they may not remember our name, but they will remember how we made them feel. They're able to
Mhm.
remember how we communicate with them and how we address their mental health needs.
Yes, I think Maya Angelou really taught us that, right? How we show up, how we make others feel, because they're never going to forget that. They might forget what you tell them, but they don't forget how you made them feel.
Yes, that's very important. Now, how can emotional intelligence help clinicians more effectively and reduce this internalized stigma?
So, emotional intelligence can reduce stigma by helping clinicians to listen beneath the surface, respond with compassion, and listen to understand, as we said earlier, and validate emotions, right? I acknowledge, and I need you to acknowledge your emotion. Respect the patient and or the care partner's goal. And notice I said care partner because a lot of times we see people as giving care, but they're truly partners in that care. And then aligning with the goals and implementing those goals as part of the treatment plan is so important, right? What are your goals? What would you like to achieve? For me, I work primarily, I'm dual certified, but I work primarily in mental health. And I say, hey, I ask, what is a goal that you would like to achieve today? And to some, that's a strange phenomenon, right? Why is she asking me that? But that helps us so much in that shared decision making process. And then understand that you are not practicing, if you're not practicing self care and person centered care, you may increase the risk of self stigma. And so that's that self awareness piece, right? And so we must do the opposite, practice self care and person centered care, and then have that mutual respect. And that can reduce that risk of stigma utilizing those EI skills.
I'm glad that you emphasize about self-care. I'm glad that also you talk about how we communicate with our patients matters most, and how we create this therapeutic alliance or therapeutic bond with the patients very important, because they really need to trust us. And basically, the nurses and nurse practitioners are consistently the most trusted healthcare workers or individuals. And thank you for what you do for leading this emotional intelligence and application for all those providers out there, because it's really really important that we apply this. Okay, it's not all about
Yes.
intelligence quotient IQ, which we really really know, but EQ is also important key that we need to apply.
Oh, yes, absolutely.
Now, nurses and advanced practice nurses are trained to recognize distress in others, but we often miss it in ourselves and sometimes in each other. Why do you think that happens? And what signs do nurses often overlook in their own emotional or mental health?
We just keep knocking on that same rock, but it's just so true that we that self-care piece, we forget about that because we're so busy taking care of others. When we get on that plane, they tell us, put your mask on before you help anybody else because you can't do anything until you help yourself. So that self-care piece is really a primary factor in that. So those subtle signs, right? How do we miss our own distress? Realizing when we become a little more irritable, right, with family or friends, because we take our work home, or even a little more irritable with the people that we serve, our patients, and kind of missing that piece, right? Because you don't have that good interaction with the patient or your family or friends, but you're missing how you're responding and how you're showing up. Then withdrawal, not doing things that you used to like to do, that anhedonia, right? We label that and we put that in our progress notes for the patient, but what about us, right? Sleep disruption. I'm not sleeping as well as I used to. More frequent days of missed sleep, and I'm kind of missing that. Oh, I just had a bad night. Oh, I just watch a little TV. But sleep is our restoration period. We need that to restore ourselves for brain development and brain rest, brain restoration. And then emotional exhaustion, realizing that you're pouring from an empty cup, because sometimes we do that. We just get up and we just go, go, go until we break down, right? And I feel like nurses are care machines. As I was looking at this question and thinking about it, I said, yeah, that's what we are, care machines. But we've got to make sure we get the right amount of oil and we reset and reboot when we need to. And so we know that we're parents, we're caregivers, we're committee members, we're advocates, we're friends, we're giving so much. And where do we usually sacrifice? We usually sacrifice with ourselves. So, people see my social media and they say, "You're always doing this, you're always doing that." Well, I'm going to take care of me first.
Yeah.
And that's how I'm able to take care of others. Now, am I perfect? Do I have my breakdown moments? I absolutely do. But I fill my cup to where I can empty it a little bit, and then I have the wherewithal or the energy to fill it back up.
I love it. Like, really, self care is really important because, as you have said, right, you can really give something when yourself is deficient with it, or you can definitely suffer burnout syndrome, which affects our creativity, emotional suppression, and you're not able
Mhm.
to at least give your best at every day. And you're correct. We're just human. They think that we could do a lot. We're doing a lot in our professional work. Our social media reflects that. But at the same time, it's also important to take a pause and then reflect like, okay, am I really, really doing this just to create an impact and influence? But how about myself? And that's the thing that we need to also recognize is to also do a self reflection and being aware that it's okay to take a rest and to take a pause and
Mhm.
do an R&R, rest and relaxation, is actually not a luxury, but it's actually our body's need to reset and be able to come up again to be our best version of ourselves.
Yes, reset and reboot our care machine.
Yes. Now, how can leaders create a culture where nurses feel safe acknowledging they're
Mm,
not okay?
that's rich. So, creating safe culture, how can we do that? So, leaders must model vulnerability, encourage a space of psychological safety, respond without punishment. And again, one of my mantras, remain curious. Simply let your team know that it's okay not to be okay. We talked about this earlier, and that the space has to be safe when they let you know they're not okay. Don't just say it's okay not to be okay, and then you provide a space that's not safe for them to be not be okay, right? And then one of the most difficult issues for me personally, and I know this is not just something isolated to myself, but I thought about this in preparation as one of the most difficult issues for me. And I say one of because there's a lot of complex things. But me as a clinic owner, wearing multiple titles, is that I can go across the border to New Mexico and practice without barriers. And in my own state, my role is seen as less than, much due to a social construct and unequal power dynamic that has not been dismantled. This is a great deal of mental weight that I carry, and I'm sure others carry that too. So I have to think about, how do I counter that I'm a leader? How do I counter that? I just understand that I'm a leader and I'm focused on cultivating spaces where people feel empowered and safe. So that's part of my work, is why I do my work, to fill my cup, right? Instead of seeing myself as a victim, I'm using that vulnerability that I have there with that thought process to really institute change. For example, my role in Texas Nurse Practitioners as president,
Mm.
using my platform for positive impact. So we really have to understand what makes us feel unsafe, and as well as what makes others feel unsafe, right?
Yes.
So where do we have our commonalities? Where can we lift each other up?
And I agree with you, right? Gone were the days wherein nurses eat their young. I think it's time for us to at least reformat that into nurses supporting each other, nurses uplifting each other. And that's
Yes,
basically needs to be happening for us to have a good patient healthcare outcomes.
exactly. Exactly. We are much better together.
Yes. Now, Dr. Tracy, you're shaping the next generation of nurse leaders. From your perspective, what should modern healthcare leadership look like today?
Love that one. Modern leadership. So, modern leadership. We're living in chaotic times, right? Complex conversations. So this is why leaders must be emotionally intelligent, they must be inclusive, trauma informed, and collaborative. So we must be proficient at balancing individualized needs while also requiring accountability. So what do I mean by that? So a student comes to you with an issue, they can't complete assignments or something like that. I can have an individualized approach while also requiring accountability and professionalism. That's a that's a balance that we have to do in modern leadership, right?
Yeah.
We want to be compassionate, we want to be trauma informed, but we also want to produce professionals, right? Who are ready for a complex society.
And I definitely agree with you, right? There's a lot of things that we could support the students, particularly if they're struggling internally and they needed a little bit of help to show compassion, but at the same time giving some tough love too. When we say tough love, making sure
Mm-hmm,
that you still follow the guidelines and making sure the
mm-hmm,
policies and protocols are instituted. Because we
exactly.
always need to make sure to prepare them for a bigger picture out of their training, and we want them to at least be the best version of the professionals that they want to be, and so that they can reach their goals.
Exactly. The pandemic changed everything. It changed us. It's changed how we navigate, how we show up. So we have to be cognizant of that.
Yes, and some programs also struggle after the pandemic. The adaptability, clinical sites have been an issue, and a lot of students also struggle with their own mental health struggles post pandemic, especially with a lot of multiple losses, depression, anxiety, and feeling of isolation. So I just could not imagine those nurses that undergone programs wherein they were not able to do like 100% in person in terms of their clinicals, right? So something is missing there that
Yes,
we really need to fill in the gaps.
of course, that human connection is key.
Yeah. Now, what do you think are the top five quality behaviors, or should every nurse, regardless of title, develop if they want to lead with empathy, clarity, and courage?
Great question. I'm going to try to make this short because I really get passionate when I'm talking about emotional intelligence because I really love it. But the top five qualities: so self-awareness, of course, knowing who you are; emotional regulation, the ability to manage your emotions; curiosity, of course, remaining curious, asking questions; and courageous communication. The ability to have difficult and crucial conversation, and then cultural humility. Okay, being able to say, "Hey, I don't understand that. Help me to understand," and then applying that understanding effectively.
That's great. And be able to apply those top five qualities will be able to at least create a positive impact to our community. So thank you for emphasizing those. And I know that emotional intelligence really goes beyond the terminology of it, but goes beyond an understanding of the person as a whole. Now,
The
what is
whole
one thing?
phenomenon.
Yeah. What is one thing you wish every healthcare professional understood about emotional intelligence?
Okay, so that I don't want to say one sentence. So I'll say one key insight. So it's not about being nice, it's about being effective, intentional, and self aware. Okay. And I feel like it should be embedded in the curriculum because our emotions drive most everything we do, how we think, how we behave, and how we act.
I agree with you. It's like our body, mind, and soul in a holistic way. What we're thinking affects our feelings, and our feelings affects our behaviors. So that's like a triad of it, and that's. I agree with you. I think we should have a training of like emotional intelligence or embedded in the curriculum, so that we could address the patient's concerns well and how we communicate with them. Because as a student, I think not all curriculums have the emotional intelligence, so that could probably be one of the added programs that we can emphasize and be embedded on it, especially on the PMHNP curriculum.
Oh, of course. Yes, definitely.
Now, if you could leave our listeners with one message about taking care of their emotional and mental wellness, what would it be?
So, a final wellness message is give yourself permission to be human, rest and emotional awareness are survival tools. Do not let people define who you are or put you in a box. You need to understand that people may upset you, belittle you, act out, or disrespect you because they are intimidated by you or even dislike you for no legitimate reason. But it is your job to lean into your self awareness and know that you are enough. Know who you are. And I think of myself as an example. I ran across an article identifying multi hyphenate people. And so the definition, basically, in a nutshell, is these people don't necessarily climb ladders on one job. And there's nothing wrong with that if you climb the ladder and you get to the highest level on a particular job. But these people can do many things with a common goal or purpose, and they do them well. And I had to understand for me that many do not understand that concept. So I have to be curious and ask questions and clarify. So again, not letting people put you in a box. That self awareness is crucial, and emotional intelligence can help you do that.
Yeah, I'm glad that you emphasize that because I think part of that is knowing your Johari's window too, right? Your open self, your private self, your unknown self, and what other people know about you, right? And what you know about
Exactly.
yourself. And that boils
Exactly.
down to the main basics of it. Now, Dr. Tracy, you're doing a lot of things. You're also involved with a lot of like leadership and also organizational role. I want to get
Mhm.
to know you. What drives this passion, and how did this started that you were inclined with the mental health field?
Okay, so I'm going to tell you, my mom was a nurse and she really wanted me to become a physician. Nothing disparaging for my physician colleagues, but I watched her work and I had a great adoration for her and how she was a leader and how she handled everything with grace and how her patients loved her. So that motivated me. So in this agreement, like I said, she really wanted me to become a physician. I think it's a great role, but I wanted to be a nurse. And she made me promise that if I became a nurse, that I would go to the highest level possible and make the biggest impact possible because she didn't want me to become a physician because she didn't appreciate her role as a nurse. She wanted me to become a physician because of the social constructs. So she was the nurse back during the day where, they pulled out the chairs for the physicians while she also managed the floor and was a leader. And so that's why she made me say, well, I won't say made. She said, if you're going to do this, this is what I expect. So that led me to, yes, if this is what I need to do, if I want a nurse practitioner, if this is what I need to do, a terminal degree, if this is what the recommendation is, this is great. But I also realized doing those things were going to help me be a better person to impact system change, right, at a systemic level. Not because she told me to, because I had to understand the rationale to realize what I needed to do. How I became a psych NP, I was in the family nurse practitioner program, and my program coordinator at the time, she said during my family program we had to take a full semester of psych,
Yeah.
which I think we should do that in our family nurse practitioner programs. And so during my rotation, she came to me and she said, "You're wonderful at this. I really think you should switch your major. You might have to even take one less class." But I told her, I said, I want to do this holistic approach. I want to be able to service the whole person. I want to be able to attend to the primary care needs while also attending to the behavioral health needs, because I believe that there's no mental health without physical health and vice versa. So I told her I was going to take a break, take a semester off, and I went back and I got my postmaster's in psych. And so that's how I ended up. I do have a daughter, a father, and a brother who live with serious mental illness. I don't think that I know that wasn't the motivator, but it did help me to be a better daughter, a better sister. I still have struggles with my brother, but it helped me to be a better mother. So it's a learning process.
I'm glad that you shared your journey. It's very inspiring. I should have said mothers knows best, and mothers usually cultivates a lot of skills instilling the values and also at least guiding you to where you want to be. And thank you for emphasizing that, and a lot of praise to your mom, and also basically how you follow the track, right? And I know that she really wanted you to be on your best version of yourself. And look at you now, you are part of the leadership team of ANP and also in HIV care. And also at the same time, you're also faculty and you're also leading the Texas nurse practitioners. Okay, can you tell us, for those who are listening right now, I may be a Texas nurse, and how can I be involved with your organization, and what will be your advice for me if I want to be a nurse practitioner and be involved with Texas nurse practitioner about the NP practice in your state?
So if they want to be, I feel like relationships are so important, right? And I think being a part of your state, local, and national organization is very important. And I realize there's a financial component to that. But as a student, there are discounts, and you can reach out. People are glad to help. Um, I'm on LinkedIn. My IG is Dr. Hicks NP. Facebook, I have my personal Facebook. It's under my name, Tracy Moore Hicks. And also, my website is ctrilogyoutreach.org. So you can learn more about me and my practice there. I mentor many people in a structured sense and in just a phone call if you want to have a conversation. Again, if you want to become a member of Texas Nurse Practitioners, I highly recommend that. Um, as a member, you can reach out to me via the TNP community page at texasnp.org, but you have to be a member. And I feel like membership is key because as we have our legislative advocacy efforts, our numbers make a true difference. Now, becoming a nurse practitioner, I have people come to the office all the time if they want to shadow. Even if nurse practitioner is not the goal, they can just come and see what it's like for the nursing department. So yes, many ways to interact, many ways to be a part. That's what I expect. Anybody who calls me for mentorship or preceptorship, that's one of the requirements, and I don't think that's a big ask.
Yes, thank you. I think if students are mentored by you, they're gonna be at the best version of themselves too, and they're gonna learn a lot from you. So, guys, please make sure to connect with Dr. Tracy Hicks if you have any questions about it. And now, Dr. Tracy Hicks, I know you're taking care of others. Now, what are strategies that you're also applying to yourself to take care about your mental health?
So my mental health therapy when I need it. I think people should seek therapy as a routine, like a preventative care, right? Not just when life goes awry, right? It should be part of your regular routine. If nothing is going on, your frequency may be once or twice a month, but everybody needs to have a good mentor, a psychotherapist if needed. Again, I said if needed. I think we all need it on a routine basis. It's just, how we do that and how we can fit that in our time. Of course, the things that we always know about exercise, lifestyle changes, making sure you drink plenty of water. Those come with the territory. But taking it back, that self-awareness piece, knowing who you are and what you need is so important. And not being afraid of that or walking away from that. For me, that is how I am able to navigate and take care of my mental health because I understand when I'm not okay and when I need time alone. And it's okay to have dinner alone and do things like that. That I used to think, oh, I would never go to a movie by myself, or I would never have dinner by myself. But I find that quite entertaining and very joyful when I do it.
Yeah, the quiet time or the self care time is also important, right?
And I forgot about the most important thing, my morning meditation. Okay. Whether it be journaling, sitting, having a cup of coffee with no thoughts, reading a Bible verse or positive affirmations or just prayer or just simple quiet, nothing, just not even moving. Those are very important too.
That's important. And I think like a quiet time or social media detox wherein we don't look at our Facebook, Instagram, or other platforms. That can also at least feed our mind because sometimes there's too much noise going on in our brain. Chemistry can be out of whack, right?
That's true, Dr. Moranti. I still have a landline, so people know that I put my phone away. My closest people know I put my phone away on the weekends most of the time. So if you need something, you have to call my landline because I put everything away.
That's important. I think setting boundaries too is very important because we kind of like life, work, and family are important. So there should always be a balance out of them, right? Now,
And
Dr.
even when you're
Trace,
working, you can have a little bit of a life balance in the work too. Like if you're going to a conference, find time to
right?
do something fun, connect with others.
Yes, and I'm so excited to meet you in person on the succeeding conference that we're going to be attending together. It'll be nice in Nevada. And then also, I know you're very passionate about substance use disorders, okay? On your role as a nurse practitioner, as an FNP and Psych NP, what do you find as the most challenging in treating these patients with comorbidities of substance use disorders and at the same time they have underlying mental health issues on top of it?
So I think the most difficult thing is helping them to get to the core of the issue, right? With substance use, right? I give you a prime example of one of the clients that has been a client of mine since 2015, when I opened the practice. And she, when I met her, her life was just in shambles, right? She wasn't connected with family. It was horrible. I met her in the inpatient setting. And I remember her telling me that her son didn't want to talk to her. So I asked her an open ended question. I said, tell me what would make your son not want to talk to you. Let's talk about that. Let's talk about that. And she said, she was angry with me at first, but she took a minute and once she answered that question, she was able to see herself. So I think the most difficult thing is people being comfortable or even having the time to really get to the story behind it, right? We all have our stories, right? People don't, usually wake up and decide to use substances, right? It's usually to cover something else or to help regulate an emotion. I remember my daughter. We had a long talk, and she said that she used because she started feeling paranoid and she didn't know how to cope with that. So she started using cannabis. And of course, we know cannabis is considered a gateway. So that led to using other things. So I think that goes back to not putting people in a box. And I think that's difficult for some because we have our biases when it comes to treating people with dual diagnosis. And so I think we need to really, again, we said earlier, take a pause, try to understand, remain curious, and understand we all have a story.
I definitely agree with you. And basically, if they don't recognize that there's a problem, then it's really hard to start treatment there, right? They really need to
Mm-hmm,
make sure that they're not in denial and making sure that they are aware and they are motivated to at least change their patterns
mm-hmm.
of behavior or their ways of coping. And from there, we can easily guide them through the process of recovery model.
Of course, we know that we have to acknowledge first before we can deal with anything. And if there's no acknowledgement, and that's from both perspectives, right? The provider and the people that we serve. We
Mhm.
have to acknowledge what the issue is and then share decision making on how we're going to approach it.
Yes. So a team approach or trauma informed care at the same time being patient centric is one of the key that we need to identify and also apply with our patients. I'm loving this conversation, Dr. Tracy Hicks, and I know you're also involved with other things, multiple things. I know they think you're a superhuman or superhero that you can juggle different things, and I love how you are involved with academia and clinical practice and fuse them together. I think that's perfect combination, and that's how educators need to be also be involved with because I think you can it's easy to teach, but if you don't have a clinical practice it's hard to connect the dots and at least you're able to
Absolutely.
influence them. Thank you, Dr. Tracy Hicks. And if there's an advice that you you want to tell for somebody who is struggling right now in terms of mental health, what will you tell them, and what will be key points that you want to tell them for those who think that there's no easy way out and just want to end my life? What will be your advice?
I would say, life is a gift. Time is a gift. We don't know how much time we're going to get. And, I'm a faithful person. God never said every day would be easy, right? Every day is not going to be easy, but maintaining hope is crucial. This is a difficult day. This is a difficult time, but this day will pass. This time will pass. Stay in there, fight. I'm going to tell you from personal experience, I have times when I say it would probably be easier if I wasn't here. I didn't have a plan, but the fact that I said that, I could just make that snap decision to end everything. We can acknowledge that we feel that way, and that's okay. But you have to maintain hope and know that this day, this time, this period, it will pass. And ask for help. There's 988. There's resources such as that. Talk to your colleagues, talk to your friends, talk to the people that you're close to. If you're a person who is an introvert, you don't really get out, pick up that phone, call 988. Okay. Pick up the Bible, journal. This is a temporary thought. It will pass. But you have to lean into that strength that we all have. It's difficult to reach in and get it, but we can, if we just put a little more effort in, just reach in and get that, pull out that strength that you already have and maintain that hope. Because I want to remind you again, this time, this period, this day, this season of your life, it will go, it will pass. Just stay in there and fight.
I love it. I love how you give us advice on it, and it's basically resonates to all the people that are really struggling, that they want to feel that they belong, they want to feel that they are not alone, and we always want to tell them you are not alone, you have help.
Mm-hmm.
Okay, and your mental health is a priority as the same as your physical health, and always remember that help is here to stay. 988 or the crisis hotline number is here to stay.
Yes, yes. You are enough.
Yes, you are enough. You are capable of doing great things. And I'm very glad that you're here. Thank you,
It was
Doc.
an absolute pleasure. This was very fruitful conversation. I really appreciate it.
Thank you, Dr. Tracy. Just one last question. I know you're a fellow of the ANP and also the American Academy of Nursing. And what is the feeling of being a fellow of these two great organizations? And what can you tell those nurse practitioners or emerging leaders out there that also would like to be a fellow?
Okay. Well, INSTA, the International Nursing Society for Addictions Nurses, would kill me if I didn't acknowledge that
Oh, yeah.
fellowship as well.
Yes.
So actually a triple fellow.
So you have a lot
But
of fellowship.
yeah, I'm just three.
Yeah.
I I can tell you it's a feeling like no other. It's a recognition of impact. And when you're seeking fellowship in any area, you have to think about how you impacted the profession and the population and what were those numbers, right? And I know it sounds a little bit self-centered, but what are you? What were your superhero capabilities? Because that's basically what a fellowship is. You surpassed what it is to be an awesome provider. Because we're not saying that you're not enough because you're a provider and you're not a fellow. But when you go to that level of fellowship, that solidifies your impact on the profession and the people that you serve.
Yes, and it's like one less than 1% for the fellowship. So
Yes.
that's basically an elite group that everybody wants to be a member of. But you need to make sure you have to create an impact. Is it
Mm-hmm.
sustainable? And also at the same
Sustainable.
time, what are your numbers and results of it?
Yes. What are your numbers and results? And is this scalable? Because that's also a question.
And is it sustainable, right?
Mm-hmm.
And the
Is it
impact that you
sustainable?
create. Thank you, Dr. Tracy. Oh my God, let's give her a warm up applause. And please follow her on her LinkedIn and different social media platforms. We're so lucky and so blessed to have you, Dr. Tracy Hicks. And thank you for staying awesome with what you're doing. You're doing amazing things, mentorship, you're doing leadership, educational side, clinical side. You're like Amazon, everything is with you, or like Costco, everything is with you, and those accolades. And thank you for what you do to our nursing community, and also continuously inspire us and give us great work and inspiration from you. I'm really, really liking our conversation. 1 hour is not enough. Hopefully, we can do this like
We could talk all day, Dr. Morante.
Yes,
we could talk
a lot
all
of
day.
topics and collaboration. Thank you, Dr. Tracy.
Thanks for listening to Mindful Moments with Pedro Morante. Be sure to follow the podcast so you'll never miss an episode. If you find value in our time together, leave a quick review. It helps more people discover the space we're creating. For updates and more reflections, follow us on social media. Until next time, take care.